The first presentation, Emin Apaydın, is the speaker in the hall. Social cognitive, the impact of violence tendency in children who are dragged into crime. Hicran Doğru, next speaker. The speaker is not in the room, the first speaker. Parent marginalization or alienation syndrome. Parental alienation syndrome. Hello and good morning to everyone. My name is Hicran Doğru, Antalya Hospital. I am working at. Today I will be making a presentation, parental alienation syndrome in custody cases. First of all, our study explores parental alienation syndrome in custody disputes. And in this objective, we use Gardner's 8 behavioral criteria. While using this Gardner's criteria, children's psychological and relational patterns, what patterns they have with their parental relations. Maybe you may be familiar. Parental alienation is not recognized in DSM-5 or ICD-11 currently, but these symptoms can impact daily life and it can cause significant problems, and symptoms can cause long-term emotional harm. And sometimes children may have allegations of sexual abuse by parents. Gardner's definition tells us for parental alienation syndrome, unjustified rejection of a parent influenced by manipulation, unjustified rejection or alienation of a parent by manipulation of other parent. And there are 8 criteria defined by Gardner. Richard Gardner is a juvenile psychiatrist, and he tells this the diagnosis in 1980s. But for a long study, because in absence of long-term studies and follow-up, because it was not verified or proved, it could not be recognized in ICT or DSM-5. The 8 criteria. After divorce, all of a sudden, blaming campaign. Second criteria, campaign of denigration. Second criteria is weak rationalizations, weak reasons or unjustified, was not taking me out, that's why I hate. The third criteria is polarized parent views for children. For instance, hating dad and loving mom, a polarized view. And the fourth is independent thinker claim. Mostly, this is claimed by the manipulating parent. The fifth is unwavering support for the manipulating parent. For instance, although they may have mistakes or inappropriate or significant support to manipulating parent, and absence of guilt in spite of all these negative attitudes and feelings, borrowed scenarios, that is, not appropriate to the developmental level or the age of the child, being narrated by the child. For instance, a child at 2 years old may tell memories that he cannot remember. These borrowed scenarios or narratives. And last criteria is animosity towards extended family or the friends of the alienated parent. We have included 33 children, 17 girls and 16 boys. These were custody disputes, cases related to custody disputes. First, we conducted interviews with child, and later on, child and mother and child and father. And without bringing the parents together, we have observed the relations with the child, and we have monitored for a period of 6 months. Key sets was psychopathological screening. Later on, we applied Gardner's 8 diagnostic criteria, and we used observational interviews and family dynamics to understand any hate or any anger or gust. And We have used t-test, correlation and regression tests to the data for statistics. Mean age was 845 or 418, low economic status or moderate, and most common were depression, anxiety, and ADHD based on our personal or individual tests. And most of the maternal custody, majority were maternal custody, 72% were the domestic violence perpetrated by the father. And paternal custody cases linked to maternal infidelity mostly. PAS scores or by custody type. Overall mean PS score was 4.94. For maternal custody cases, the scores were much lower. Paternal custody that were due to infidelity was significantly higher. And its relation to psychopathology. With psychiatric disorder, the scores were much higher, which was significant and meaningful. And regression analysis of the findings shows us predictors of PAS, custody type, and psychopathology of the children, which correlates to the severity of the syndrome. And as conclusion, PAS, parental alienation syndrome, is a real and measurable concept, although ICD and DSM-5 not included. And custody context matters, the causes, the contents matters, and bi-directional link with psychopathology. Clinical implications shows us needs for early identification of PA dynamics and importance of multidisciplinary assessment to understand this psychopathology, because the implications and impacts can be long and severe, even leading to sexual abuse claims and allegations. The children's pathology may worsen the case, or to the contrary, it has bidirectional relation, as we said, and tailored or customized interventions needed during custody evaluations. It's critical. Our limitations of our study. There was small sample size and single center study were included. The samples were in a single center, and subjective interpretations may be needed because there was a prolonged 6 months interview and impartiality may be harmed. As conclusion, parental alienation syndrome, PAS, has clinical and legal implications, and multidisciplinary approach needed. Both clinicians and legal authorities or teams needs to be provided to for clinically relevant pattern, especially in custody cases, and it has significant impacts on and effects on the mental health of the child. Early diagnosis or recognition is key, and more structured tools and longitudinal studies are needed. Thank you. Thank you. Any questions to the speaker? Thank you. Merve Okuyucu, next speaker of the session. B12 levels in anxiety and depression. Hello. Hello, dear friends. Today, I will tell you the role of serum vitamin B12 in adolescent anxiety and depression, the preliminary findings of the study. I'm an expert or specialty doctor. My name is Merve Okuyucu. I'm working in Doğu Beyazıt State Hospital, psychiatrical clinical for minors and juvenile. Anxiety and depression disorders has significant impacts to daily life, and it's one of the leading causes of suicidal tendencies. Especially anxiety and depression symptoms can be seen simultaneously and frequently. Mental disorders, if not treated properly, may cause long-term negative impacts in childhood and in adolescence, and this has impacts on the impacts of the life quality of the people and academic performances. Therefore, early recognition and intervention is critical for mitigating the impacts. The anxiety and depressions, adolescent anxiety and depressions, biological causes is not very clearly defined, but there are studies. Some vitamin deficiencies, especially B12, may have a significant role in etiology of depression and anxiety disorders. Vitamin B12 has impacts on brain functions and for the secretion of neurotransmitters, and it is intake by nutritions. Low vitamin B12 levels can cause the severe anxiety and depression episodes in the adolescents. Depression and anxiety and serum vitamin 12 levels, the relation is studied. And for the patients with the depression and anxiety diagnosis, the B12 level was below 50%. And for 60%, the B12 level was below 250. And these findings shows that vitamin B12 deficiency has vital role on depression and anxiety. The objective of the study was to understand the adolescents with anxiety and major depression disorders and the relation of these disorders with vitamin B12 levels. In adolescents, low vitamin B12 levels may cause the anxiety and depression. This was our hypothesis. Methods, and this was longitudinal study, and Doğru as a doctor, Yaşar Er Yılmaz State Hospital was where the study was conducted, and it gives the preliminary findings. And after the assessments and evaluations, 43 adolescents were included in the study. 30 of them had the common anxiety disorder, and 4 with major depression disorder had primary diagnosis, and control group had 8 adolescents of health, sound mental health. The cases and control group flow chart you see on the screen. A total of 43 patients were included, and out of 59 potential participants, some others had other psychiatric symptoms, and they were and some others were not fulfilling the criteria. And in control group, 3 of them did not fulfill the criteria. Therefore, 2 of the potential participants were not included because of other psychiatric disorders. The inclusion criteria for the case group is DSM-5 criteria, any of the anxiety disorders or major depression disorders diagnosis. For control group, DSM-5 criteria, no psychopathology diagnosed as for DSM-5 category. The exclusion criteria below the age of 13 and being above 18, having chronic diseases and mental development disorder, alcohol or substance abuse and addiction, and vitamin B12 supplement in the last 1 month, and other psychopathologies other than these 2, and unwillingness or involuntariness to participation. Clinical assessments were used, key sets, and we used CHIDOTS for CHADO, and blood serum levels were tested for B12. In addition to diagnostic statistics, serum B12 levels and the relationship between the anxiety, correlation analysis were conducted. Findings and results. Mean age was 14.84. There was preliminary findings, and there was very small control group. No comparison was made between these 2 groups, and 30 common anxiety disorder, 4 major depression disorder, and 8 healthy individuals. 11 of the common anxiety disorder had also accompanying major depression, and 1 social phobia. Social demographic characteristics included in table 1. Number of siblings was differentiating from 2 to 8, and the birth sequence was 1 to 8. Many of the parents were married, and families' history of psychopathology was almost no. Findings, according to analysis, serum B12 level, major depressive subscale score, and total anxiety program, there was no relation between these. In addition to this, as expected, depression and anxiety, there was meaningful correlation between anxiety and major depression, and table 2 shows the total analysis conducted. So discussion, serum B12 level and the relation between the anxiety and depression, but the data findings shows that serum B12 levels has no correlation between depression and anxiety. This shows that vitamin B12's impact or effects on anxiety and disorder may be complicated, and it needs to be further studied. Thank you. Thank you. Any questions to the speaker? Thank you. Taha Çağrıhan Karaboğa, next speaker. COVID-19 pandemic's effects on the anxiety of adolescents. Gülcan, Akyol, Tekfiliz, next speaker of the session. Hello and good morning, everyone. My name is Gülcan Akyol, Tekfiliz, Gebze State Hospital. Investigation of adolescents with internet gaming disorder and problematic internet use and those with substance use disorder in terms of attachment and emotion regulation skills. Objective. Although the etiology of addiction is not fully yet understood, emotion regulation difficulties have been identified as a risk factor for both substance-related and behavioral addictions. Early childhood impacts. Individuals with negative self-concept rooted in early adverse relationship may turn to addictive behaviors as a way to cope with emotional stress. And this study explores the link between attachment and emotion regulation, focusing on difference between internet and substance addiction. Findings are expected to contribute to a better understanding of addiction etiology and support medical and psychotherapeutic approaches. Our study was conducted in Bakırköy in child psychiatric clinic, and there were 53 participants diagnosed with substance disorder, 57 participants in internet addiction, and 33 healthy control with no psychiatric diagnosis. Out of 34 individuals, as for DSM-5 criteria for internet gaming disorder, IGD, and also a young internet addiction scale was above 50. 53 individuals showed problematic internet use, PIU, but did not meet the DSM-5 criteria for IGD. Exclusion criteria: illiteracy, intellectual disability, and presence of psychotic diseases, bipolar disorders, and autism spectrum disorders were exclusion criteria. The measures we used were KIDSETS, Emotional Regulation Questionnaire for Children, Toronto Alexithymia Scale, Revised Inventory for Parent and Peer Attachment, Revised Form, and Young's Internet Addiction Test, Addiction Profile, and Adolescent Form were used as tools. Results. Findings for emotional regulation skills. In the Internet Addiction IA group, reappraisal scores, ERQ, were lower, and suppression scores were higher than those of control group. However, these differences were not significantly important. For the substance use disorder, SUD, reappraisal scores were significantly lower than the healthy control group. Suppression scores were higher, but the difference was not statistically significant. Total alexithymia score were significantly higher compared to the control group. In both internet addiction and substance use groups, that was significantly higher. Total alexithymia. A comparison between internet addiction and substance use disorder groups revealed no significant differences in reappraisal suppression scores for emotional regulation. The correlation between the scales shows us no significant correlation was found between emotional regulation, reappraisal subscale, and parental attachment score. There was not significant correlation, but a significant negative correlation was observed between emotional regulation suppression subscale and Toronto parental score. There was negative correlation. In addition, the mediating role of emotion regulation skills in the relationship between parental attachment and addiction severity was examined separately for each addiction group, and for both subscales, no significant effects were identified. Although no significant difference in emotional regulation subscale scores were found between internet addiction, but however, the previous studies shows that there was lower reappraisal in internet addiction and higher suppression positively. These inconsistencies may be due to there was negative correlation and suppression positively associated with the internet addiction adolescents. There were studies. The reason for this, the small sample size, reliance on self-report, the inclusion of both IGD and PIU in the group, and it was self-reporting scale. When compared to healthy controls, individuals with substance use disorder had significantly lower reappraisal scores on ERQ, while suppression scores showed no significant differences. This is consistent with the previous research reporting similar patterns. And reframing negative experiences may contribute to impaired emotion regulation and increase vulnerability to substance use. For alexithymia, individuals with both EI and SUD had significantly higher total alexithymia scores compared to healthy controls. And this finding shows that there is correlation between alexithymia and gaming disorder and internet abuse, and this is lack of self, there is potential risk. When internet abuse and substance use disorder groups were compared, no significant differences were found in emotional regulation skills and alexithymia scores. There was no significant differences between the two groups. And this contrasts with the previous study involving adolescents and young adults, which identified distinct emotion regulation and difficulties linked to different types of addiction. These discrepancies may be due to comorbid psychopathologies and methodological variations across studies. The attachment and addiction severity, the mediating roles of reappraisal and suppression in the relationship between attachment and addiction severity were not significant. This contrasts with the previous study showing that emotion regulation difficulties mediated link between anxiety attachment styles and substance use and IGD in young adults. These differences, this was contradicting with that previous study, that these differences may be caused by the small sample size or inability to analyze emotion regulation as a total score and separate assessment of addiction types. This may be due to these reasons. Our limitations, if I may briefly tell, the high prevalence of comorbid psychiatric conditions in the sample group and emotion regulation abilities, the assessment of emotion regulation based solely on reappraisal and suppression strategies, the lack of a separate assessment of maternal and paternal attachment as attachment. These were limitations. And also the limited number of female participants presenting with substance use and problematic internet use contributed to sample heterogeneity. The number of female participants were lower, and this was a limitation of heterogeneity, but also reflecting the gender-specific clinical presentation of these disorders. The similarity in age and gender distribution between the clinical and control groups is considered a strength of the study. However, the relatively small sample size limits the generalization of these findings. Conclusion and recommendations. Internet and substance addiction are critical issues among children and adolescents, often leading to significant functional impairment and adverse outcomes. Considering the challenges associated with the treatment, the importance of early preventive mental health interventions is very significant. Although this study is valuable due to a limited number of similar investigations in the field, its cross-sectional design and relatively small sample size limits the generalizability of the findings. Therefore, future research should focus on larger samples and longitudinal studies and multi-method approaches will contribute to the field. Thank you for your attention. Thank you.
Evet, soru yok herhalde.
There is no question from the audience, and so the next speaker of this session. And so we would like to invite the next speaker of this session. So can you open the slide, please? Okay. Good morning to all of you. I am Mehmet Sezgin. I'm working in the Göztepe Professor Dr. Süleyman Yalçın City Hospital, and I will be talking about the diagnostic relationship between the suicidal attempts and the parasuicidal behaviors in child psychiatry inpatient hospitalized following following the pandemic area. And as we see that psychotic disasters begin in the childhood, adolescence, and studies indicates that suicidal leading cause of emergency admissions with the prevalence rate of 3 and 11%. And actually it is illness, family conflict, past suicide attempts, abuse, substance use, and drug overuse being the most common risk factors that are included. And it also shows that only the 1/4 of the suicidal attempts requires the hospitalization, and it's often accompanied by parasuicidal behaviors. And we have limited hospitalized services provided for the suicidal attempts. And so Professor Dr. Süleyman Yalçın City Hospital, established in February 2022, plays a crucial role in addressing this gap, providing inpatient care and contributing to scientific knowledge. And the primary source reasons for hospitalization in adolescent psychiatry is the suicidal risk, and often accompanied by parasuicidal behaviors and the non-psychiatric disorders. And the severity, understanding the severity, recurrence, and the diagnostic associations of the suicidal and the non-suicidal self-injury is essential for effective treatment planning. And this study aims to evaluate, first of all, psychiatric characteristics and diagnostic association of the adolescents hospitalized for suicidal attempts, focusing on the NSSI history, personality traits, and comorbid psychiatric disorders. And so for the methodology perspective, and so between February 2022 and October 2024, we have included 135 adolescent female patients hospitalized for suicidal attempts at Göztepe Professor Dr. Süleyman Yalçın City Hospital, and psychiatrists and KIDI schedule for affective disorders and schizophrenia present, and the lifetime version were used. And so the patients were divided into two groups based on their current self-injury behaviors, and suicidal and the suicidal plus non-suicidal. And when we look at the results, and all of 135 patients, including still were female, and within the mean age of 1606 with the 1 point event, and psychiatric history was reported in 129 patients, and 109 of them had a history of psychotropic medication use. And the suicidal group consists of 93 patients, while the suicidal plus non-suicidal non-suicidal group included 42 patients, and the rate of prior psychiatric hospitalization was significantly higher in the suicidal and non-suicidal plus non-suicidal group, and the history of the previous non-suicidal self-injury was also significantly higher in the suicidal plus non-suicidal group. And when we look at the axis 2 personality trait and the diagnosis of the bulimia nevrosa were more common in the suicidal plus non-suicidal group compared to the suicidal group, and also the suicidal desire subscale of the Beck scale where suicidal ideation was higher in the suicidal non-suicidal group compared to suicidal group, and so it is significantly higher than the other one. So when we look at the logistic regression analysis, identified a history of the prior NSSI as a significant predictor of these groups. And on the discussion group, so we would like to share our findings indicate that adolescents exhibiting both suicidal and the non-suicidal group present with more severe clinic profiles. And so in this group, exist two traits, and the bulimia nevrosa rates were higher, and actually, together with the it shows that there's a positive correlation between the NSSI and the borderline personality features in adolescents, and also higher frequency of bulimia nevrosa in this group also supports early findings that borderline personality symptoms are more strongly associated with the bulimic behaviors and than the anorexic symptoms. These comorbid features may reflect underlying impulsivity and emotional dysregulation common to both conditions. And additionally, prior suicide attempts are known to be linked with the increased NSSI urges and higher suicide risk, as shown in the large adolescent samples. And this reinforces the importance of identifying and addressing NSSI in suicide risk assessment. In summary, presence of both suicidal and the non-suicidal self-injury behaviors may indicate a more complex psychiatric presentation, and that warrants closer clinical monitoring and individualized interventions. And as a conclusion, due to the limited number of child psychiatry inpatient units in our country, clinical experience and the scientific studies in this field are restricted, and our study is valuable as it provides on a limited and high-risk population. Patients with a history of suicidal and NSSI present with more complex and severe clinical profiles and with the higher rates of previous NSSI and personality disorder traits. And these findings highlight a critical importance of the detailed evaluation of the NSSI history and comorbid psychiatric diagnosis in treatment planning for patients. That was all from my side, and thank you very much for listening to me patiently. And Göztepe Psychiatry service has been closed, and so it was an demonstration and advertisement of this unit that has already been closed. And Aybala is the next speaker of this session. The floor is yours, Ms. Aybala. And actually, good morning to all of you. So I have been working as a specialist in the Istanbul Forensic Medicine Authority, and I will be working about we will be talking about I will be trying to show you and as during the adolescence period, as we know that, and it is a period where the physical, emotional, and the cognitive changes demonstrate, and it is very affected by the parenting patterns of especially in terms of the body perception and the self-respect of the person, and as we know that it is one of the parent and also apart from the especially and we know with that it has many, it may have impact on the so as we have examined here, and especially we have started to And so we examine the body perception and self-esteem levels of the children aged 12-18 whose parents has applied. And so we have also tried to see the anxiety and depression situation of the parents who have had cosmetic tendencies and their children aged between 12 and 13, and therefore to investigate family attitudes affecting body and self-esteem levels in the children. And so we have seen, we have checked, so we have population, we have included here 173 parents who, and so the study inclusion criteria applying to the plastic and reconstructive aesthetic surgery polyclinic to have an aesthetic procedure for cosmetic procedures, and for the exclusion criteria and inadequacy as suggested by the clinic interview, and severe psychiatric diagnoses such as autism, and also psychiatric disorder. And so we have also used for data collection form and the variables of the studies, the demographic, and so scales apply to the children, the scale and the schedule for the affecting disorders and the schizophrenia for school-age children present and lifetime sector. And so for the statistical methodology, and as you see here, we have also checked the correlation studies, and the normality assumptions of variables were examined with the skewness of the kurtosis and the coefficients and the Smirnov test. And for continuous variables, Mann-Whitney U test was used for two groups, and relationship between the categorical variables were also examined. And so at the very beginning, so when we look at the parents, and the first 45 of these parents had already have aesthetic surgery, and 28 of them had applied for the first time. And also when we look at for the when we have assessed actually the self-respect scale of the child, and also bodily perception of the child, and we have checked this as an initial analysis of our research, and no relationship was found between the parents' marital status and education level, and the employment status, income status, and place of birth, family integrity, and total number of children, and number of the children aged between 12 and 18. And and we have seen that adolescents' body perception and the self-esteem scores had no correlation. And so we have also checked how we can foresee it in the later phase, and therefore, and actually. And so for the bodily perception and the self-esteem and the self-respect of the child, and when we added it to the psychiatric treatment, and we have seen that psychiatric treatment history was also significant. And afterwards, so we have applied it to the scale, and we have seen that it has explained 28% of these variance. It still kept its significance, and however, when it comes together with the family evaluation scale, and that's so the results of this hierarchical regression analysis performed in the past in the part of our study showed that surgery history, psychiatric history, family assessment scale, communication were also significant, and therefore this study, and they have also demonstrated that it has also provided, and the findings particularly in this initial analysis indicated a relationship between, and we know that it's a bit between there's a relationship between the parental history of the cosmetic surgery, improved body image, and the self-esteem in the adolescents. These findings is consistent with the previous studies showing that the cosmetic surgery increases self-esteem and the body image. However, when family dynamic and were included in the regression, the model, the direct effect of cosmetic lost its significance. And however, we have also seen that in all regression models, parental psychiatric history was found to be a consistent predictor of the adolescent self-esteem, body image, and this is consistent with the literature showing that parental emotional states such as depression, anxiety, and indirectly affect adolescents' development by altering the family interaction and the communication patterns. And the communication and the roles of subscales of the family assessment scale is significantly explained variability in adolescents by the image and the self-esteem. And while recent studies have shown that aesthetic surgery increases self-esteem and the body satisfaction in adults, the indirect reflection in this effect in adolescents appear to be shaped by the family dynamics so although the study provides important findings, it is not possible to establish the causal relationship due to its cross-sectional design. And additionally, expanding the sample to include more diverse socio-demographic groups could increase generalizability of these findings. And considering these mediating factors can also improve the quality of this study. Thank you very much. And good morning. So I will be talking about the uncertainty of suicidal risk in adolescents, levels of intolerance, emotion, and the organization strategies, and parents' relationship with attitudes. And so first of all, as we see here, and according to World Health Organization data in 2019, approximately 709,000 people died because of the suicide in the world. And when we look at the Turkish and when we see the according to in Turkish Statistical Institute, and in 1977 the when we see that there are many different suicidal impacts, suicidal behavior is multidimensional condition occurs as a result of the combination of various factors, including genetic predisposition, neurobiological factors, psychological states, and environmental factors. Psychological approaches to understand suicidal behavior have gained significant momentum and development, and there's so many important theories have been proposed to examine the processes underlying the suicidal behavior. And however, so in our study, we aim to examine the phenomena that we may think be effective in the process of suicidal attempts in adolescents with the suicidal ideation. And actually the first intolerance of uncertainty in transdiagnostic factor that contributes to the development and the maintenance of many disorders. Recent reviews have also begun to define intolerance of uncertainty as a cognitive bias and the personality trait that affects the preconceived beliefs about uncertainty and effects. And so especially as we know that difficulty in emotional regulation has been associated with the suicidal thoughts and the suicide attempts, both respectively concurrently and respectively from adolescence to adulthood, and has also shown to be a predictor of this condition. And during the adolescence, individuals undergo major transformations in their ability to evaluate and understand the complex situations and desire to become autonomous in the individuals. And so as a methodology, so we have created and Professor Dr. Süleyman Yalçın City Hospital inpatient between the 10th of 15th of October 2023 and the March of 15 of March 2024 was taken as a research sample, and we had also control group. And as we see here, we have applied in adolescents in both groups included in the study, and Columbia Suicide Severity Rating Scale was applied, and the psychodynamic data for inform children's intolerance of uncertainty, emotion regulation inventory for adolescents, and parent attitude scales were used. And we have also used HIAS as for the interim monitoring, and we have seen that a total patient of 140 patients with an age range of 12.32 and were included in our city. 98 of them had attempted suicide, 42 had suicidal thoughts and hadn't attempted suicide. And so when we checked together with the difficulty coping with the uncertain situation, and also to uncertainty of the future anxiety. So we have seen that they had significant correlation between our studies. And so our one of the aims in our study was to create models focusing on the diagnostic and the diagnostic processes through examining the transdiagnostic factors. And we have created two models here, and especially so we have intolerance of uncertainty total score, suicidal ideation in the last month, and also suicidal attempt, and the indirect effect between two parts have been also taken into consideration. And for the discussion part, so it was found out that high levels of intolerance to uncertainty, maladaptive emotional regulation strategies, and the incompetent parental attitudes were associated with the suicidal attempt in adolescents with suicidal ideation, and regardless of their diagnosis made with the categorical diagnostic systems. And among these phenomena, the high level of intolerance of uncertain and internally dysfunctional emotional regulation strategies have been found to have a mediating effect on the transition. And so we have seen that thanks to these results obtained from our study, theoretical models have been created to predict the risk of suicidal ideation. According to the results of this study, we believe that adolescents with suicidal ideation may attempt to suicidal effect if they are primarily evaluated for higher levels of intolerance to uncertainty and compliance. And in addition to conventional methodology of psychopathologies, we also need to add treatment, the psychological pathologies that are associated with the suicidal ideation in adolescents. Actually, so we have also performed validity of our scoring for the intolerance to uncertainties. I think so. We would like to we invite Gülcan Çelebi as the next speaker of the session, as we don't have any question for the current speaker.
Assistant at Kocaeli University, Department of Pharmacology. I hope you'll find my presentation as productive as previous ones. Today I am going to present our study on how post-weaning social isolation stress impacts behavior and brain regions with a focus on hippocampus and prefrontal cortex in rats. I would like to emphasize that this is the preliminary findings of my doctoral dissertation, and molecular analyses are ongoing. This is how my presentation will go. Upon conducting a comprehensive review of extant literature, it is evident that early life stress has been associated with long-term changes in stress reactivity, emotional regulation, and cognitive performance. However, there is a significant research gap in understanding how social isolation immediately after weaning affects the developing brain, specifically the prefrontal cortex and hippocampus, two critical structures in the limbic system that interact cognitive functions, regulation of mood, and stress response. Furthermore, with growing isolation in today's world, especially during the pandemic, understanding its neurobiological consequences is crucial. Therefore, in this study, our objective was twofold. At behavioral level, we objected to assess anxiety-like, depression-like, obsessive-compulsive-like behavior and memory performance. At molecular level, we objected to investigate stress-induced changes in BDNF, inflammatory and oxidative stress markers in prefrontal cortex and hippocampus. To achieve this, post-weaned male Wistar rats randomly divided into two groups. One group housing controls. Other one, isolation rearing rats. Isolated rats were housed individually and socially deprived play, tactile and visual contact. Following 8-week isolation period, behavioral tests were conducted. Elevated plus maze test for anxiety-like behavior, forced swimming test for depression-like behavior, passive avoidance test for emotional memory, Morse-Water maze test for spatial memory, marble boarding test for obsessive-compulsive-like behavior. Beyond these behavioral tests, we also measured the total locomotor activity scores for validating the findings of these behavioral tests. Following behavioral testing, we collected hippocampal and prefrontal cortex tissues for molecular analysis. We measured BDNF levels, both ELISA and PCR, but tumor growth factor alpha, inducible nitric oxide synthase, superoxide dismutase, peroxisome proliferator activated receptor gamma, receptor advanced glycation end products level measured just PCR. This is a time flow chart of the methodology of the study. The differences between groups were determined by students' t-test. Data was expressed as mean plus or minus standard error of mean. Notably, total locomotor activity was unchanged, indicating that these behavioral changes were not associated with general hypoactivity. The percentage of body weight change in isolated rearing rats were significantly higher in isolated groups than group housing controls. In comparison with group rearing controls, isolated rats spent significantly more time in open arms in elevated plasmaze test, indicating anxiety-like behavior. Isolated rats also exhibited depression-like behavior as evidenced increased immobility time and decreased struggling time in forced swimming tests. They also significantly buried more marble than controls in marble burying test, exhibited compulsive-like behavior. Furthermore, isolated rats showed reduced performance in passive avoidance test as evidenced reduced retention latency, and they spent less time in escape platforms quadrant in Morse-Water maze test. These are molecular alterations in hippocampus and prefrontal cortex tissues were summarized in this table. As you can see, BDNF level significantly decreased in both brain regions, but BDNF gene expression increased in prefrontal cortex, possibly neurocompensatory mechanism. Elevated TNF-alpha and inducible nose in prefrontal cortex shows inflammation, but this increase was insignificant in hippocampus. Superoxide dismutase, indicating of oxidative stress response, increased in both brain region. PPR gamma and RAGE showed opposite trend. PPR gamma decreased in prefrontal cortex, but increased in hippocampus. Possible neuroprotective mechanism also could be. Post-weaning social isolation stress is a contributing factor for behavioral and cognitive impairments. While the prefrontal cortex showed signs of compensatory regulation of protective genes like BDNF or superoxide dismutase, it also exhibited greater neuroinflammatory activation. On the other hand, hippocampus may rely more on PPR gamma-mediated neuroprotection, but was still affected behaviorally. Our findings suggest that the prefrontal cortex is more vulnerable to neuroinflammation and oxidative stress. These divergent patterns may help explain the behavioral impairments observed. To conclude, post-weaning social isolation stress causes significant behavioral and molecular changes. The hippocampus and prefrontal cortex are both affected, but via different mechanisms. These findings emphasize the importance of investigating region-specific interventions, molecularly targeting oxidative stress, neuroinflammation, possibly PPR gamma activation to mitigate the adverse effects of post-weaning social isolation stress. Our results could provide insights into developmental windows where interventions might be most effective in preventing neuropsychiatric disorders associated with early life adversity. I gratefully acknowledge that for the financial support thank scientific research projects of Kocaeli University. And for the scientific support, I would like to thank you, Kocaeli University Center for Stem Cell and Gene Therapies Research and Practice, Kocaeli University Experimental Medical Research and Application Center. As I come to end my presentation, once again, I want to celebrate the National Sovereignty and Children's Day, which is meaningful for our nation and future generations. Thank you for your listening.
Thanks for the presentation. Any questions?
Oh, thank you. I really liked your talk. I think it's very important to consider the continuity of early adverse childhood experience. So I'm curious about, has anybody looked at these adolescent isolation changes in animals that had adverse experiences early? I'm thinking about the model of Michael Meany with rat mothers that were attentive or not attentive. So the animals that are not stimulated when they're young, I would expect them to do worse with this later period of isolation. If you could comment on that, that would be good.
Thank you for your valuable question. There are several isolation methods in the literature, and maternal separation is the earliest one, postnatal day 1 to 14, and adult term isolation is also possible. And there are also some combinations with isolation stress and acute stress in these ages. But the earlier exposure to stress, the more best result, more bad results, I think. Cognitive impairment, etc.
Thank you. Any other questions?